This conference will now be recorded.
Awesome. So we've struggled this year with working on finishing up our community health assessment due to COVID and the impacts from not being able to meet face-to-face for one, and then two, with all of our time really being spread thin with COVID-19 responsibilities of the health department. And we were all, I think, across the state hoping for some sort of extension on some of the deadlines for our plans. And we got word from the state that there are no extensions for these plans. So we definitely have to deliver a community health assessment by the end of the year, and we're so close, so I'm not worried about that. But we also have to deliver a community health improvement plan as well finished by December 31st. So I do not see us having a problem if we stay diligent in being able to do those things. And we've got to remember that a community health improvement plan is one of those documents you don't want to just put on the bookshelf and leave it up there for 5 years. You actually want to work within that and make changes as you need to. So I did want to let you know that we are on that trajectory right now to complete the CHAW, the community health assessment, and to complete the CHIP by December 31st. So I just wanted, for anybody that's new on the call today, just to kind of review what we're doing. Every 3 to 5 years, we have to complete for our accreditation a community health assessment as well as a community health improvement plan. And for this cycle, we have chosen to use the MAP framework. That stands for Mobilizing for Action through Planning and Partnerships. It's a best practice planning tool recommended by the National Association for County and City Health Officials to oversee your health improvement processes. So the primary things that are going to come out of this and the tools that come out are a community health assessment, the CHAW, and a community health improvement plan. So right now we're in the assessment phase of the CHAW, and there are 4 main assessments of the CHAW. We've completed the Forces of Change assessment already. We had the community health status assessment completed as well, and we completed the community themes and strengths assessment. So we are down the home stretch, and we can see light at the end of the tunnel. And the final assessment that we need to do right now is called the Local Public Health System Assessment. Whoops. And I went way over. Hello. So we are ready to launch this assessment. And I know we've talked about it before, and we had hoped to have had this launched earlier, but we are finally ready now to launch it and complete this 4th component of our CHAW. So this assessment is part of the National Public Health Performance Standards. It provides a framework for assessing the capacity and the performance of a local public health system. And the purpose for conducting this assessment is to identify areas for improvement. So you or your organization on the call today, you play a critical role in our local public health system, and we're going to need your expertise to help shed light on how well we are doing or not doing providing the 10 essential public health services. So this assessment is generally conducted face-to-face, and if you remember, we were actually trying to host this meeting back in April as COVID was coming in and starting to cancel everything, but still we're not meeting in large groups the way we normally would, and we're not going to be able to do that now. So because of COVID, we're going to go ahead and conduct this assessment through an online survey. So we wanted to develop just a quick orientation to the assessment to give you a little background that'll make you feel more comfortable taking the assessment and understand some of the ins and outs of the assessment. So just a few objectives for today that we're trying to get across. We want to be able to describe what the local public health system is and how it fits into the overall community health assessment. We'll define it again because some people think the public health system is only the health department, but we want to make sure we definitely articulate that it's much broader than that. We want to review the 10 essential public health services. And then we also want to share a few tips on how to complete the assessment. So as I mentioned before, the first thing we need to really get in our heads is what the public health system is and how much broader it is than the local health department. It's really what we do collectively as a community to assure that the conditions in which people can be healthy they're able to be healthy. So this collective action involves a variety of organizations, agencies, groups, and individuals, and basically no single entity can provide all the public health services in the community. And I think that's really come across during this COVID pandemic, and how many people and agencies are involved in answering that pandemic right now. It's definitely not just the health department. There's a lot more people involved, and we've been able to see that on a larger scale for sure. But when you think about it, police, fire, and emergency departments, they prevent and respond to emergencies that threaten personal safety. We've got teachers, school health nurses, parents that all protect the safety and health of children. We have city planners, transportation authorities, neighborhood associations, and businesses that all provide access to services that promote and support healthy lifestyles. And kind of like we heard today, bus routes, safe roads and streets, safe parks, recreational facilities, and vendors that sell nutritious foods. And finally, we have community groups like churches, homeowners associations, and civic organizations that provide insight into the quality of health and services in our community. So when you think about this assessment and the items that you're going to rate in this assessment, you need to not only think about what the health department is doing, but how are we as a system of organizations performing on some of these items when you go through it. So just briefly looking at the public health services that, these are the essential ones that we're going to be looking at. So we're looking at monitoring the health status to identify and solve community health problems. We also diagnose and investigate health problems and health hazards in the community. We work to inform, educate, and empower people about health issues. We mobilize community partners and into action and help identify and solve health problems. We develop policies and plans that support individual and community health efforts. We work to enforce laws and regulations that protect health and ensure safety. We link people to needed personal health services and assure the provision of health care when otherwise unavailable. We assure competent public and personal health care workforce. We evaluate the effectiveness, accessibility, and quality of personal and population-based health services. And finally, we work to research for new insights and innovative solutions to health problems. So you can see that this is a pretty broad range of activities that they say all communities should be undertaking in terms of serving public health needs in the community. So that's a lot of a big scope of work there. So just a few notes before we dive into the essential services really fast. So each one of these essential services has about 2 to 4 model standards that are going to be ranked. And we're going to ask you to rate them to the extent to which you see these essential health services occurring in our community. And while there are going to be specific standards definitely aligned more closely with the health department, for other standards, definitely keep in mind how well that broader health public health system is performing that we looked in that previous slide. So we understand that you're very busy right now, and there's a lot of standards that you might not know. So we're working behind the scenes to make sure that we, when we ask you to take this survey, that we're giving you the essential services that you're more familiar with and you interact with more, that you will only be rating those as opposed to rating all 10. So we're working hard on that plan right now to make sure that we do that. So I just briefly want to go over the essential services. You can see that I'm not going to read all of these on the screen, and we've got 10 of them, but I wanted you to see the sort of things that you're going to be asked to look at. Basically essential service 1, where we're looking at how do we monitor the status and identify community health problems. Basically they're asking us, do we really know what's going on in our community? Do we know how healthy we are? And we're looking at the community health assessment that we're conducting right now, which is that CHAW. Do we communicate that out and use, different technology to communicate those pieces of information? And then are we looking at maintenance of population health registries as well? So I'm just going to review these one by one really fast, and you're going to get all of these in your survey, and you will get a copy of this presentation as well. But I just wanted you to see the breadth of what we're looking at rating. Essential service 2, diagnosing and investigating health problems and health hazards. It's really asking us, are we ready to respond to health problems or health hazards in our county? how quickly do we find out about these problems, and how effective is our response. So we're going to be looking at the identification and surveillance of health threats, identification response to public health threats and emergencies, and looking at how is our laboratory support for investigation of health threats. For Essential Service 3, we're looking at how well do we keep all segments of our community informed about health issues. So we're going to be looking at how well do we communicate as our health education and our promotion of these to a variety of policymakers, stakeholders, and the public. Looking at our healthcare communication plan to see if we've got that out with the media, the public, and other local public health organizations. We're also going to look at our communications plan and our laboratory support for investigation of health threats. Essential Service 4 is looking at mobilizing community partnerships to identify as well as solve health problems. So how well do we truly engage people in local health issues? So we're going to look at our constituency development. How are we finding out who needs to be part of this and who are our community organizations that we work with, and then also looking at the partnerships that we're forming to solve some of these needs, strategic alliances we're putting together to solve some of the issues that we find. In Essential Service 5, we're looking at developing policies and plans that support individual and community health efforts. So basically, what local policies in both the government and private sector promote health in our community? And how well are we doing setting local health policies? So we'll be looking at the governmental presence at the local level. And you can see on here too, is one of it is making sure that the local health department is credited through the National Voluntary Accreditation Program. And then looking at public health policy development, and that we're reviewing policies at least every 3 to 5 years to make sure that they're still needed and that they don't need any updates to them. Also in Essential Service 5 is looking at community health improvement planning processes and strategic planning, and that's part of what we do with our community health improvement plan. And then also looking at how we plan for public health emergencies, looking at our task force and coalition, and looking to make sure that we've got preparedness and response plans there and that we're ready to respond when we need to. Essential Service 6 is enforcing laws and regulations that protect health and ensure safety. So basically, when we enforce health regulations, are we technically competent, are we fair, and are we effective? So we're looking at how we review and evaluate laws, regulations, and ordinances, and they're looking at these being reviewed at least once every 5 years, and looking at the involvement and improvement of laws, regulations, and ordinances to make sure they're addressing what we need right now in our community, and reviewing those at least every 3 to 5 years. And finally, looking at the enforcement of laws, regulations, and ordinances, and making sure that groups and organizations are following those so that we can maintain health in our community. So Essential Service 7 is linking people to the needed personal health services and assuring that the provision of health care when otherwise unavailable. So basically, are the people in our community receiving the health services that they need? So we'll be looking at identifying and how well are we identifying those personal health service needs of different populations in the community, and then ensuring that those people are linked to personal health care services, and how do we do that? In Essential Service 8, we're looking to assure that we have a competent public health and personal health care workforce. So basically, do we have competent public health staff? Do we have competent healthcare staff? And then how can we be sure that our staff stays current? So we'll be identifying personal health service needs of different populations and looking at our workforce assessment and how do we track that. So those are things we do, and we're going to be ranking and rating how well do we do that right now, and do we have any areas for improvement? How well are we ensuring that people are linked to personal health care services, and is our workforce there with the required certificates, licenses, and education that they need to be able to do that well? Also, we want to make sure that our staff have a lifelong learning curve, and that they're continuing their education and training and mentoring to ensure that we're staying on top of what we need to deliver for those 10 essential public health services. And then we're also wanting to make sure that we're looking to formal and informal leadership development opportunities for employees at all levels of the organization. And that we're sharing that organization with the local public health system. So that's the gist of what we're trying to do there, and then what you're going to rank. For Essential Service 9, we're looking at how well do we evaluate the effectiveness and the accessibility and quality of personal and population-based healthcare services. So basically, are we meeting the needs of the population we serve? Are we doing things right? And probably more importantly, are we doing the right things? So we'll be looking at how well we evaluate those population-based health services and if they're working. We'll also be looking at evaluating personal health services, the accessibility of those, the quality and the effectiveness, and then hopefully using those evaluation findings and how well do we do that to improve services and program delivery. And also in Essential Service 9 is evaluating the local public health system, which is what this whole assessment is about, that we are looking at how well we are doing at least every 5 years and taking the results from that evaluation process to improve our system. So our last essential service is Essential Service 10, and it is focused on researching new insights and innovative solutions to health. So we're going to be evaluating how well do we foster innovation, and how do we discover new ways to get the job done, and do we have rooms for improvement in that? So there's a lot of different measures in here that we'll be ranking. Are we linking to institutions of higher learning and research, and conducting research together? And then do we have staff and researchers that have the capacity to initiate or participate in research? So that was a very quick overview of all the 10 essential services, but I didn't want to bog you down and go into each one of those measures. They're very lengthy, and as I said earlier, we are going to definitely make sure that the survey link that you receive is specific to your role in the local public health system, so that you're not having to evaluate all those measures. So just a little thing on the demographics. We would normally do this meeting obviously face-to-face. So we would have a sign-in sheet and we would get all of your demographic information in there. But one of the critical things for our accreditation is making sure that we've hit a lot of our sector partners in that local public health system assessment diagram you saw earlier. And making sure that we've got a broad enough participation and input from people. So we want to make sure that we get your organization or your affiliation, your name, and we would love your email address, because if there are questions that we have based on some of the feedback that you gave us, we definitely want to make sure that we're able to touch base with you and clarify, if anything for those questions, if we have them. So please make sure you don't skip that demographic section. I think we've made some of those items where you can't skip it and move on. So, but we did want you to know that, we're going to keep your identity to you, but we definitely wanted, if we needed to reach out, wanted to make sure we could do that. So another tip, assessment tip 2, we just kind of wanted to walk a little bit over the rating scale that we're using that's been provided by NACCHO for us to use. So for each of those model standards that you saw, you're going to be asked to evaluate on how we're doing. So you're going to be selecting anywhere from I've seen no activity all the way to we have the optimal activity happening in our community. We have little room for improvement, and we're really good. And we don't really need to do much. So obviously we hope to have more optimal activity, but we definitely want to identify areas where we have no activity occurring, or we've got minimal or moderate activity, and we've got some places where we can improve. I think that would be expected at any community. It's balancing that out. But I did want to kind of talk to you a little bit about the no activity versus don't know. So you're going to see this rating scale and things will be rated that way. But if you actually come across an activity, which you probably will, that you have absolutely have had no interaction with and you really don't know if there's activity occurring or not, we wanted to give you an option there to say, I don't know. And that will mean that you have no idea. No activity means you definitely know about this measure and there is definitely no activity happening. So I just wanted to kind of clarify that so that we make sure. We'll reiterate that in the email as well that goes out with the survey, but I did want to review that just to make sure that you know what the difference between those two mean. And otherwise, that should be a fairly easy ranking to do. And then the third tip for this assessment, so when we would do this survey face-to-face, there would be some really fun and interactive sessions with group tables of people where in groups you could kind of discuss some of these together and come up with a consensus, whereas one person at the table might not know something happened, another person would, and then you would come up with a consensus and talk about it. And what that did is it produced a lot of rich conversation and context to some of the rankings and the scores that would come out. So obviously doing the SurveyMonkey is going to not give us as rich of some context that we want. So we're hoping that that when you are in there and you want to rank something and you know you need to rank it as no activity or minimal or even moderate, or even if you had a significant but you still think there's room for improvement, there's going to be a comments on the standard text box open under every one of these so that you could provide a brief comment there that might help us in understanding what improvement might be an opportunity that we could really work on there. Those open comments will not be shared by your name, but we're going to try to put that in our final report too, and as well back to everyone so that when we want to rank and prioritize which of these elements we want to really work on right now, that there's context to that too. So we highly encourage you to take that opportunity, just real brief comment. It doesn't have to be long. And then if we do have a question, want more input from you, we will give you a call for sure and reach out and just find out a little bit more context to that. But I can't stress how important that piece is going to be for us and being able to understand the context of your comments. So please take that time for that. So just to review the timeline we have set up for this to make sure that we can get this information to finish out our community health assessment, but more importantly, inform our community health improvement plan objectives that we're going to be working on as well. So right now we're going to open up this assessment through a SurveyMonkey starting October 12th. We're only going to have this open for a 2-week window. So right now, I think the whole survey with all of the 10 essential services with the measures, I think it's about a 23-minute survey. Now, obviously, if you put comments in there and take a little more time, it could take up to a half an hour probably. But like I said earlier, we're not going to give you all of those to rank. You're going to be given some specific ones to rank. So I hope you can grab a pumpkin spice latte, maybe sugar-free if you need it. Put on some relaxing music and just sit down and have fun with the survey because it's going to be so much fun. I know it. We really need your input. So between the next 2 weeks, please schedule some time to take this survey on your calendar when you get that link. We really need your input on that. So after we get all of your responses, we're going to take that survey, and I think I put the 24th, but it probably won't be till that Monday. I'm going to correct that, but we'll take about a week to do the data analysis, pull out that report, and start drafting that report. We will take that information to the CHA steering committee to review and kind of look at and see if we need any more information. And then we would like to present that report and open up for some discussion at our next Healthy St. Lucie Coalition meeting, which is going to be on November 12th. So that's a lot of information about that. Any questions for me? I know you've probably got some, or maybe you've got suggestions on how we put this out that would be important for me to hear now. Is everybody still here with me?
You've done yeoman's work, Jen. It's a lot of information. You've done yeoman's work. It's a lot of information to cram into a few slides and communicate it. Thank you.
I know it was I didn't want to go over too long. It's very lengthy, and I think many of these are pretty, obvious, and you'll be able to read them and understand, or you're not going to know anything about it at all. So we're going to try to eliminate as much of that as possible. Yeah, but I think you can see how important this is going to be just for our strategic planning at the health department and looking at our coalition and how we're working. This is going to be some really good feedback to look at how we're working together or not working together in certain areas. So any questions? I don't know if we have anything in the chat box. I'm going to open that up.
Nope, we're clear.
We're clear? All right. So be expecting emails to start trickling out next Monday with a request for you to complete the survey, and the faster you can do it, the better. Then we don't have to chase you down, hunt you down. So let me see what else is on here. I'm going to stop my recording here.
Maybe.